For 6 dependents, family of 8, our premiums are pretty high as is in 2025 at $1,100 a month. That does not include dental and vision. If we stayed on the exact same plan or same coverage type, our insurance premium is projected to go up $1,500. So our premium would then be $2,600.
Yeah.
I will also say,
yeah, $2,600. Let's say that here, I'm going to pull up their quote thing here. Like, let's say these people are in Texas. I don't know what state they're in. I'm going to say they're about 40 years old, husband and wife with their 6 kids. Here's how much their premiums are going to be. It's a large family, but look, for the junkiest plan through an insurance carrier you never heard of, WellPoint, Imperial, we're looking at close to $1,800 a month with high deductibles. And if they're talking about $2,500, maybe they have a gold level plan that's like good insurance. Yeah, this fits within their prices here. Let's see. And these are still with like carriers you never heard of. Let's see like what Blue Cross, Cigna, United's going to cost these people. Yeah. Even if they're getting a subsidy to get like one with a major carrier, like, look, this plan's good, 0 deductible, pretty low max out of pocket, United Healthcare, Blue Cross here. These are all HMOs too, which is tough. Like some states, like Texas, Illinois, Georgia, a bunch of these states, they don't even have PPO options, like the ones that give you, like they cover you nationwide. You don't need a referral to see a specialist or like a pre-auth for anything. But like, even if a state did offer a PPO, like let's look at Florida real quick. Let's say these people lived in Florida. That's a Florida zip code right there. All right. Yeah, it costs even more in Florida for bronze, but let's do PPO. That's going to be Florida Blue. Look at this. High deductible, $3,600 a month. You want a 0 deductible, but it's bronze, so a lot of the benefits aren't good. $4,000. If you want to see how high these go, let's see how high the premiums go. We're going to go to their most expensive possible plan. We're talking $8,500 a month, platinum level. There are people that pay this much, by the way. The thing with all these health insurance options is like, dude, let's just see what she says. Like they're healthy, but like this is why so many people are going to private insurance, because private insurance gets you a discount based on your health history, not your income. And that ends up saving people way more money, especially this year, than income-based subsidies. But check it out.
That we are all generally pretty healthy. We do not have any pre-existing conditions or major medical ailments. That is the highest premium I have heard of. When you hear people talking about our healthcare system is broken, case in point. I'm not.
There you go. And the thing is, like, you can get plans. Like, I don't know if she can get down to $1,100 anymore with a family of 8, but she could get something pretty good, like on the private side, PPO with one of the major carriers for like $1,200, $1,300, a good, really good option. Worst case, it'll be like $1,800, but it's not going to be $2,500. But dude, honestly, like, tell me, like, these premiums have gotten so out of hand. Like, they are so out of hand. And on top of that, there's just mass layoffs everywhere. Yesterday, I read that Wendy's, the fast food chain, is laying off. No, not laying off. They're closing over 300 stores later this year. If fast food can't make money, like who the heck is making money, Because people don't have that extra cash to even buy a Dave's Double from Wendy's, get that ghost pepper ranch. You see it with McDonald's, they're closing. You see it with businesses like UPS, even Amazon, laying off thousands of people, tens of thousands, and Microsoft and all that. This year, by the way, we're looking at like 13.8 million layoffs so far, and there's still a month and a half left in the year. We might reach like 15, 20 million layoffs this year, and it's going to get worse next year. So people can't afford anything. And a lot of people are going without health insurance as a result. I mean, if you want to get some help to get some reduced rates, just visit healthnerd.net. It's the only way that I've seen that people are saving on their premiums, because they do public and private options. And the cool thing is, unlike any other website on the internet, you go to Health Nerd, they'll actually give you a quote range. They'll actually educate you on your best route to go for insurance. And the best part is nobody calls you. You don't get blown up by 100 calls. All right, let's see what it looks like when you apply to get a quote online on other websites.
Last night I was doing some research on health insurance, just seeing if I could get it any cheaper than I'm already getting it. and it was very late at night, and I accidentally filled out one of those things that was like not real. It was like a scammy thing, and after I did it, I was like, I bet I'm gonna get a ton of emails about this. No, I didn't get any emails. But you know what? Between 9:30 and 3 p.m. today, I've gotten 78 phone calls. 78, and I've answered about 50 of them. I think I'm gonna have to change my phone number. Has this ever happened to anybody else?
Yeah, it happens to a lot of people. You put a request online and you're done. And you know, the thing about like this applies to like you do a refinance, like for your car or house, or you want to estimate on solar panels, or like really whatever it is, you want to estimate for something. You put these requests online, and they never give you an estimate. Like, dude, you're going on that website just to get a price, just to see if it's even worth your time. Let's see if it's even worth my time before I have to spend, half an hour on the phone with somebody. Let's see if it's worth my time. And can you tell me a little bit about why I should do one route versus the other? But no, you go to these websites, and what they do, they get all of your info. They're going to ask you up front, name, date of birth, your height, weight, health history, family history, your income, your address, your email, your phone number. And then you know what they do? You get to the last page, and then they don't give you any info. All it says is, great, thank you for the info. Someone's going to be calling you shortly. And it's not someone. I mean, it'd be okay if it was one person. I think we'd all be cool with that. But they sell your info to like dozens, even hundreds of people. And it's like for a long time too. There's even like, I'm on lists when I put like requests for quotes online from like 2 years ago, and I still get calls about it. They sell your info. So it's like all lead gathering data, except for Health Nerd. That website is made to give you info. You get your quotes. You can get education on anything to do with health insurance on there. And then if the quote range sounds good and you're unable to find something yourself, which most people can't, I mean, with private options you can't. You have to work with a consultant or whatever. But then you can schedule a call with one person. No info sold. No one else is going to call you. Okay? That's why it's better. But right, so like the state of health insurance is just ridiculous. The economy, very tough. Credit card debt. And when we're talking about a mortgage payment for your insurance, it's no wonder why so many people are going without health insurance now. They really change things. And like the plans that are somewhat affordable, like in your price range, if you can find them, they are like terrible. High deductible. They don't cover anything. So, you can at least try getting a private plan if you can qualify. But other than that, I think we're all screwed. Yeah. All right, like, comment, subscribe. We'll have more fun on the next one.